beginning with the heart. The main vessel, the main vein here that's going into the heart is the superior vena cava. Now, coming off the ventral surface of the superior vena cava is this little guy called the internal thoracic. It's also called the mammary vein. And over to the side here, you can see another branch. This is called the azygos vein. Returning now to the superior vena cava, notice that it splits into a letter Y. Each branch is called a brachiocephalic vein. The brachiocephalic vein continues and becomes the subclavian vein. Now right about here you can see that the external jugular has come off and is heading toward the head. Some cats have an internal jugular which is thinner and right here, but most cats do not. So this is the external jugular. Now I'm going to turn the cat a little bit and you can see a branch off the external jugular is called the transverse scapular. So this is transverse scapular here. Now, going back to our brachiocephalics, it becomes subclavian when the external jugular comes off, and then as you head into the armpit area, we call it axillary, and once you're out into the arm, we call it brachial. One major branch off this highway is this guy here. This is your subscapular vein. Back to the heart again. This is the arch of the aorta. And the biggest branch coming out of the top of the arch is the brachiocephalic artery. Now, the brachiocephalic artery gives three main branches. This is the left common carotid, this is the right common carotid, and a third branch over here is the right subclavian. So all three of those came out of the brachiocephalic. The left subclavian comes out of the arch directly. It's not a branch off the brachiocephalic. If we follow that left subclavian, it comes up and arches around the ribs here, and just like before, subclavian becomes axillary. So when you're in the armpit area, it's the axillary artery. If you continue to follow it into the arm, we call it brachial artery. This is brachial artery. Now the brachial artery will split right around the elbow into a radial artery and an ulnar artery. Another branch off this main highway is the subscapular artery, which you can see right here. And that subscapular artery is recognizable because it goes with the subscapular vein. Those two always plunge into the cat's shoulder together. Going back to our brachiocephalic artery, we mentioned the two carotids that come off and the right subclavian. An important little branch to look for off that subclavian is this guy here, the vertebral artery. It's very small, but it leaves the subclavian, heads up toward the head. Now this cat's left lung was removed so that you can see the arch of the aorta become the descending thoracic aorta. And as it comes down here, it becomes an abdominal aorta. There are two main branches that you want to look for off the aorta. The first one's kind of easy to find. That's the superior mesenteric, and it has this slanted look, and it's heading toward the intestines. The other one is called the celiac trunk, which is indicated here. So they're very close together. This is the celiac trunk. The celiac trunk gives three branches, three arterial branches that you'll want to look for. The easiest one to find is the first one. It's almost a continuation of the celiac trunk, and that's called the splenic, and it's heading toward the spleen. The second branch you can see here is the gastric, and that's of course heading to the stomach. The third branch, which is often the hardest to find, is usually the lowest, and it kind of goes backwards. It heads deep into the cat's body toward the liver. So this is the hepatic artery. Now this artery was broken, but you can see that it's heading backwards toward the liver. So again, hepatic, left gastric, and then this is the splenic branch. Okay, this is the descending aorta again here, and I wanted to show you the renal artery, which obviously goes into the kidney. And then there's another ventral branch off the aorta here. This is called the inferior mesenteric. It's a smaller cousin to your superior mesenteric. Now, as you continue to follow the aorta down, there's going to be another branch here called the iliolumbar artery, and that one's always pretty well plastered to the back of the cat. Now, the final thing to look at is this pelvic area. And what you're going to see happening here is that aorta is going to split into an external iliac artery here and internal iliac arteries inside. Now, if you look very carefully, there is a caudal artery way down in the middle. So this is caudal artery, this is internal iliac, this is external iliac artery. Continue to follow the external iliac artery toward the leg, and when a branch comes off right about here where the leg joins the body, that's your deep femoral, and that means that this now becomes the femoral artery. If you continue to follow the femoral artery out, the superficial branch here is the saphenous artery. This is the inferior vena cava, which came out of the heart and has traveled through the thoracic cavity, is now in the abdominal cavity. This is the renal vein, which branched off the inferior vena cava. And a little further down you can see an iliolumbar vein, which also comes off the inferior vena cava and is partnered right there with the iliolumbar artery. Now, when the inferior vena cava descends, it splits, just like the arteries did. The first split right here is called the common iliac vein. There were no commons in arteries, but there's a common iliac vein here. As that vein continues toward the leg, right over here, we're going to call it the external iliac vein. But in between, right where my probe tip is, you can see there was a broken branch there of the internal iliac vein. And that's what branches off and heads down toward the cat's back, but it divides the common iliac vein from the external iliac vein. As you continue toward the leg, there's a deep femoral branch that comes off, just like it did with the arteries. And then once we're in the leg, we call this femoral vein, and the superficial branch is called the great saphenous vein.